Now, in an attempt to tackle the stigma and reluctance of people to test for HIV, South African authorities are recruiting traditional healers. The healers are part of a pilot study to encourage more people, especially the young, to have the test and to seek medical treatment if needed. Here's a report from Johannesburg.
Shadrach Mashabane's hut in rural South Africa has all the trappings of a traditional healer. His home in the town of Bushbuck Ridge is covered with traditional fabrics, and there are glass bottles with herbs and medicines. But what stands out is a white box containing an HIV testing kit. Mashabane is one of at least 15 traditional healers who are taking part in a pilot study run by the University of Witwatersrand. Researchers have trained them to carry out HIV testing and counseling to encourage more South Africans to be aware of their HIV status and prevent the spread of the disease.
From the start, we begin with our traditional consultation work. Then I explained the HIV testing. Many did not really believe or trust that we can actually do this kind of thing because it is unusual. What most people know is that testing only happens in clinics. So at the very beginning of the study, they really looked down on us.
It's the most significant public health program to involve traditional healers. There are plans to expand the program later this year, with at least another 325 healers undergoing training to become certified HIV counselors. Researchers at the university will compare rates of HIV testing to see whether more people prefer to get tested by the healers rather than the clinics.
It's a feasibility study where we wanted to assess whether we can be able to train traditional healers to test for HIV, or the clients who go to the traditional healers, will they be able to accept HIV testing if it's done from the traditional healer, and also to create an environment where traditional healers and the clinics or staff are working together.
South Africa has one of the highest rates of HIV in the world. Stigma remains in many communities around the disease and its treatment, even though HIV antiretroviral medication and pre-exposure prophylaxis are free. Concern about privacy at clinics also keeps people from seeking help. Many people in rural areas see traditional healers as their first point of contact for illnesses, and the project hopes they can help change attitudes about the disease. South Africa's large younger population is a special concern.
I don't give up if I test a person and find them positive. I talk to them, encourage and advise them to go to the hospital. I keep the referral and wait for them to advise on when they can go to the clinic. Should they fail, I personally walk to the clinic, accompanying them, committing myself to take them to the clinic so they can get treatment.
Around 2,000 traditional healers operate in the Mpumalanga province town of Bushbuck Ridge, home to about 750,000 people, providing traditional and spiritual services. The researchers hope testing and treating via traditional medicine practitioners could ultimately lead to the end of new HIV cases in communities. Their ultimate aim is to inspire South Africa's government to roll out the program nationally. Africa Bureau, WION, World is One.
For all the latest news, download the WION app and subscribe to our YouTube channel.